You feel so depressed, like not being able to see and function on a day-to-day basis. You always have to rely on something to actually be able to see your world around you. It's disheartening. Like you feel absolutely like horrible inside.
Gabby Bilodeau has suffered from debilitating dry eyes for many years. When she stepped into Higgins Brothers Vision Care in Plainville, it was a clear solution.
It's a constant daily struggle, so having someone in your corner that wants to get to the root of the problem, to actually improve it and give you a sustainable treatment, it makes a world of difference. It makes you feel confident, like, okay, yeah, I'm hurting right now, but I can improve.
Dr. Don Higgins has several treatments for dry eyes. No matter what the cause, he says he will get to the bottom of it.
We do see routine patients, but the primary focus of our practice is dry eye disease. We often are a referral-based practice, so we're seeing patients that have been referred in by other doctors, very often other eye doctors.
Starting with the transformative IPL, or the intense pulsed light treatment known as OptiLight. Dr. Higgins' office has now had it for a year and a half. It's
just the most powerful tool I've ever gotten to work with. I mean, what it can do for these patients is just amazing. And OptiLight just, what it does is it works on the meibomian glands. It basically gets rid of the inflammation that's on the eyelids. When the inflammation goes away, the meibomian glands begin to function again. It actually is regenerative. I've seen cases where the meibomian glands looked atrophic and I thought they were missing. And we've done 4 sessions of OptiLight and the glands kind of come back to life. They start producing oil again.
It's a treatment many have said is a game changer.
4 treatments. I did my 4 treatments spaced between 3 to 4 weeks. And just recently, after the treatment, I started doing the PRP, the eye drops. Amazing. I can't even, it's just life-changing experience. I'm so grateful.
Dr. Higgins' office also offers radiofrequency therapy.
What we'll do with radiofrequency is that it will heat the lids, heat the meibum. I can melt it, express it, basically giving the patient an oil change, and allowing their meibomian glands to replace the inspissated or thickened oil with healthier oils. So that's an adjunct therapy we have. We'll use that. We do meibomian gland probing when necessary if they have obstructed meibomian gland disease.
And now their latest new venture, platelet-rich plasma, a treatment that can expand Dr. Higgins' reach even more.
We're the first and only office in Connecticut, I think probably even New England, that does it. But we're developing our own platelet-rich plasma. And the platelets have these incredible regenerative properties. So it's basically for a subset of patients, host versus graft disease, Sjogren's syndromes, neuropathic corneal pain, and some of the really severe dry eye patients that have a lot of corneal involvement. But the platelets have just restorative properties that you can't get with any other type of treatment.
A different kind of process with a powerful result.
We have our patients come in, we have a nurse that comes in, draws their blood, and then we put it in a special device, centrifuge it, and we create these little bottles that has PRP or platelet-rich plasma for our patients, and they take it home with them. And typical initial course of treatment is going to be about 5 to 6 weeks.
They're absolutely wonderful, and it's cool to see, like, we can do it here in the office too. You see the centrifuge spin, you see your blood being turned instantly from being red to this yellowish color. It's like, oh, I put that in my eyes? That's so neat.
To get these cells to regenerate, to be healthy again, it's equivalent of taking your windshield that is all dirty and then cleaning it up so you can see through it. It's amazing.
Dr. Higgins will find the right focus no matter which treatment is right for you.
I really feel like the privilege is given to me. The fact that someone comes in, they entrust themselves to us, they come in with a problem and look desperate, and we can return their function, their health back to normal. You know, there's nothing more satisfying.
I mean, since a year ago to today, I mean, a magnificent OptiLight, I would say, and the PRP drops, amazing. And Don is one of the best doctors you can ask for.